So this is my topic. Once they've got it, it's very hard for them to let it go. Exploring the experiences of professionals when a young person's education healthcare plan, or EHCP, is ceased. So a little bit of the current context. So as you're all aware, introduction of the education and healthcare plans came within the 2014 Children and Families Act. The Code of Practice acts as guidance to help you enact the legislation. Some of the purpose of the education healthcare plans was to increase participation of children, young people, and parents in decision making. Explore their aspirations, outcomes, and promote independent skills and preparing for adulthood. And in the previous system, the number of statements of SEN were relatively stable year on year since the introduction. But with education and healthcare plans, that's increased each year since the introduction by about 35,000, 40,000 each year. And that means we're looking at about 440,000 education healthcare plans at the moment. And only a fraction has ceased because the needs can be met without a plan. So for example, last year, 440,000 education healthcare plans, only 800 and something were ceased because their needs could be met without it. And there's limited information on the criteria to cease an education healthcare plan and this ambiguity within the legislation. So one of the reasons you could cease a plan is because outcomes have been met, but as we know, when outcomes have been met, you can normally just write new ones anyway. And much of the current research focuses on families who have received a plan or in the process or through the application process, but no current research is in the experiences or processes at the end of the education healthcare plan life cycle. So towards that kind of, in this little circle, towards the end of it. And so my kind of research was looking into plugging that gap, understanding the lived experiences of those who had had a plan cease, the professionals involved in that process, and how ceasing might be better monitored, reviewed, and implemented. And this kind of led me on to my research questions. So the first one is, how are decisions made to cease an education healthcare plan? And that was looking at professionals' views, how are children and young people involved, and how professionals work together as well. And then the second one, how do SENCOs and SEN officers describe the key factors that influence the ceasing process? This was looking at what are those kind of facilitating factors that help the process go well, and what are some of the challenges that get in the way. So research design wise, so from research paradigm is pragmatism. Are you all right? Okay, there's lots of things going on over here. So my research paradigm was pragmatism, which I quite liked because it's about developing solutions and focusing on the outcomes of the research. And it kind of allows flexibility and adopts a needs must approach. So you can adapt your practice depending on what the research is looking at, which I thought was particularly pertinent during COVID-19. It was a mixed methods design, so convergent mixed methods design. You can see by that little picture over there, I gathered the quantitative data and the qualitative data at similar times, and then analyzed them at similar times as well. I used volunteer sampling, so that was I sent emails to local authorities across the UK, across England, sorry, to get them to take part in my questionnaire. And then I emailed schools and those local authorities who hadn't taken part in my questionnaire to have interviews. So you can see I had SENCOs across England, all within secondary schools or above. So 23 took part in my questionnaire, 13 in my interviews. And SEN officer-wise, I had 17 complete my questionnaire and 5 complete my interviews. And then data analysis, I used descriptive statistics for the quantitative information and thematic analysis for both the qualitative information in both the questionnaires and the interviews. And this is just a quick little map to show the kind of rough location of my questionnaire participants. So it's kind of nicely spread across England. Nothing really happening in Cornwall. Anyway. So these are my main findings. So on the left, you've got my kind of my summary of my findings from my survey, and then that's kind of my thematic map from my interview. So from the survey, plans were predominantly ceased because their needs have improved. That was things like medical needs, SEMH, or their developed independent skills. Trusting relationships between parents, schools, and local authorities was key, and those multi-agency discussions helped that process move along. Perceptions of education healthcare plans hindered these kind of independent skills in preparation for adulthood. So similar to my interview findings, this perception of education healthcare plans as a safety net or a golden ticket meant that people were more cautious about reducing the support, thinking about a graduated approach, because they thought that would lead on to their plan being taken away. Clear criteria was needed with those kind of open discussions around ceasing from as early as possible, with reviews and follow-up discussions post-ceasing. So coming back to the child 6 months after their plan has been taken away or ceased to kind of review how they're being supported now. Do they need that support back in place? And largely, lastly, with the survey, and I think this comes up quite a lot, and I think it came up in Lauren's research as well, is that capacity issues affected those joined up decision making. And in my interviews, similarly, I'm just going to kind of pick a few of them. So again, there was this kind of perception of education healthcare plans as a safety net or a golden ticket, which again kind of led into wanting to hold on to this plan because they believed it was a protective factor, and also not wanting to cease it because they felt it opened doors up for them. So things like, and outside of education as well, so opening up things like child support and extra benefits. And then from the middle one, it was around, I think the key ones were around that lack of capacity. So again, that kind of people didn't have time to have those multi-agency meetings, to update plans, to kind of review what was being put in place properly. And this need for clearer guidelines and pathways. When should we cease? Why should we cease? What does it look like? And maybe some case studies as well. And then factors that support decision-making. So I think the key ones probably for us are clear updated plans, making sure that especially when children are transitioning to new settings, making sure those plans are reflective of that child now. Keeping the plan through transitions. Secondary to college was seen as a good time to cease, but actually these are for really vulnerable children with complex needs. So we know transitions are difficult for them. So keep it through that, even if it's only temporarily. And a graduated approach to ceasing. So reducing that support over time, promoting those independent skills so that when it ceases, it's not kind of a shock to the system and they've developed those independent skills. Thank you. Implications. So I think a lot of these are really relevant to us as educational psychologists or soon to be educational psychologists. So clearer guidance and pathways. So the code of practice was reviewed in 2015. It's due to be reviewed last year, hopefully this year because of COVID. Greater standardization across local authorities in both the practice and the paperwork. Clear transitions to adulthood, and I think this is one of the ones where we can get involved in, is when a child has those kind of complex needs, that means that they will be moving on to adult social care afterwards, actually trying to put in place those links earlier and try and have that transition earlier rather than waiting until 25 and then try and transition on. Presence during review meetings, so not just people like SEN officers, but us as educational psychologists being there, talking about graduated approaches, talking about independent skills, and this clear message of this graduated approach from us as well. So promoting how to reduce support over time and promote independent skills. And again, something that we're really relevant to us is smart outcomes preparing for adulthood. So thinking about if the child, preparing for adulthood needs to be at year 9 at least, but earlier is better. But thinking about what kind of independent skills are they going to need to meet their aspirations, and how can we write it so it's relevant towards college, relevant in secondary school as well. And then lastly, bringing the child and young person into discussions about their support. And that's done.